So it's Wednesday morning, November 4th, about 8:30. I'm going into Dr. Hale's office for the final consultation, the final eye exam. They're going to measure my eyes, shape my eyes, and figure out exactly what they need to do come Friday morning for my LASIK procedure. First person I see today is Patty McStrack. She's going to take me back and put me through all the eye exams to get all the numbers that Dr. Hale needs. And then I'll meet with Dr. Hale later today.
Today's appointment is about an hour and a half to 2 hours long with the surgeon to do some diagnostic tests and see if the patient is a good candidate. Been thinking about LASIK for some time?
Yeah, I've been thinking about it for probably a couple of years now.
Good. When we're capturing a scan here, the main thing I want you to realize is that we're not touching the eye, no puff of air or anything like that. We will do a complete health check of the eye, as well as the checking corneal thickness, making sure the refraction check, patient doesn't have any eye diseases, the health of the eye is normal, and the surgeon will talk with Mike about the procedure and length and make sure that he's aware of the surgery.
You know, you go through that battery of machines around here. And the object of that is that we're looking for underlying odd sort of conditions. There's one specific thing that we're really looking for. It's called keratoconus, and that's something that we've got to absolutely rule out. Mm-hmm. And we do that through several different ways. We have several different machines that examine your eye and different things. What we're looking for are odd curvatures. Or really odd changes in your prescription. Your prescription has changed a little bit over the last several years.
Can you see that, Mike?
Vaguely. Not really, yeah.
All right, cover the other eye. Anything?
No.
Okay.
Blurry.
You had the machine, remember the machine with the rings in it, the bright rings?
Yeah.
The little bright rings reflect off your eye. A camera takes a picture of that, and then it calculates by the position of the rings. It calculates the shape of your eye. So we have pictures of those, and then the computer looks at them, and it gives us whether it thinks it's normal curvature or it's not. You came out normal and nicely normal on those. Cool. Then there was the gizmo that has the rotating camera.
Yeah.
The rotating camera device is very interesting in that it actually is three-dimensional. So what it does by rotating around and taking slices, pictures at slices, that is actually capable of looking at the inside, the back part of your cornea, and actually a little bit inside your eye. So we looked at that one, and you did fine on your right eye, and you did fine on your left eye. So what we end up with is all this stuff. We end up with these graphs. We end up with pictures of infrared pictures of your eye. And all this, all these little bars talk about these are internal aberrations in your optical system, and this is what makes custom. All right, it's a lot of this. The customizing incorporates that data, even if it's relatively minor data. It's looking at that data and it's trying to keep it in check, because we used to think that's where night vision issues came from, with changes in the higher order aberrations. Again, conventional treatments have no clue. They don't know they're there. They can't measure them. They don't treat them. They don't do anything.
Right.
All right.
Something that comes to mind, handle everything.
Yeah.
Right.
If you think of anything else, between now and then, just call us and just ask us.
Oh, yeah.
Sometimes something popped into your mind that you wanted to think about.
So I just finished my final consultation. My exam is on Friday. It's Wednesday morning. We just did the whole complete 2-hour exam. My eyes are dilated, so I get to wear these cool things behind my glasses. Otherwise, it's way too bright. They retested all my eyes and everything that they did last 2 weeks ago. And the Dr. Hale explained everything that he's going to do on Friday, all the way from the moment I arrive through every procedure, showed me a small video on what exactly happens to my eye and everything that's going to happen on Friday morning when I come back for the procedure. So I'm looking forward to it. It's good.